Cancer Center.
Dr. Chaudhary's only been at FHP for a month and already sees up to a dozen cancer patients a day. As he becomes more established at the cancer clinic, he expects to average closer to 20 patients a day.
Basically, what we do is I give chemotherapy treatments. I joined FHP in August, and what we do is, patients get diagnosed with cancer, and when they come to us, we, advise them what kind of treatments they need and what kind of complications or side effects they will have from treatments. We also ask them about, their history and any prevention they can do for future or for their family. When the patient is diagnosed with cancer, generally if there's, let's say, a lump in the breast, they will go to the family doctor and they will order a mammogram, and after the mammogram a biopsy is done. And after the biopsy, once the diagnosis is established, they generally come to us, medical oncologists, for further suggestions. And we recommend whether the patient is going to need any chemotherapy prior to surgery or after the surgery. And that is basically done by us. And once we recommend that, then we work accordingly.
He knows he's only one component of comprehensive care a patient will need once diagnosed with the disease.
Cancer is basically one of those diseases that require comprehensive care. It requires family physician, and it requires a surgeon, it requires medical oncologist like me, and radiation oncologist for radiation therapy. And sometimes it requires every one of us for treatments. And during treatments and even after treatments, we continue the care of the patient, and a lot of times there are other supportive services involved. Nursing care, and also help from, if any help, financial help is needed. I think Guam Cancer Care does that for us. Helps the financing and sometimes treatments or referrals off island.
Smoking, poor diet, alcohol consumption, and sun exposure all increase cancer incidence.
Common things to remember about cancer is, what you inhale, what you eat, what you do in your daily life, and all these matter.
Throughout the islands, he's seeing higher incidence of cancer with betel nut shores, as well as women who fail to get regular pap smears and mammograms.
Cancer of the cervix in this area incidence is higher because women generally don't have pap smears done regularly. They don't get vaginal exams done regularly. Same token, breast cancer incidence is higher as well because women, especially in the islands around Guam, they are not getting frequent checkups and mammograms.
Health Check is presented by